Well, let's go ahead and get started, and some more people will hopefully be joining us soon. I'd like to welcome everyone and introduce our speakers who will be giving us a 10-minute presentation on solutions for strengthening accountability for the hard to reach. Gita is a member of the Independent Accountability Panel for Every Woman, Every Child, Every Adolescent. And Walter Flores is the director of the Center for the Study of Equity and Governance in Health Systems, Guatemala. Gita, would you like to begin?
Sure. Do you want to wait a second because the number of participants keeps increasing, or should I just get started?
No, we can take another few moments. Definitely, let's try and be inclusive of everyone. Yes.
Yeah, because I'm seeing the number rolling.
I'm just eager to hear your presentation. I'll be polite though.
Okay,
well,
I'll try not to disappoint you.
You could never disappoint me, Gita. Welcome to those of you who are now joining us. We'll be starting shortly. We just want to make sure that everyone can get in. All right, Gita, I believe we are at a good spot to go ahead and start.
Okay. So, hello again, Barbara, Walter, and everyone who's here in breakout room 4. Accountability for the hard to reach. Accountability in health systems has been notoriously weak for too long. Even more so, as we know, for those who are poor, marginalized, oppressed in some way, and particularly women, adolescents, and children, lower castes, ethnic or racial minorities, indigenous people, the disabled, migrant workers, refugee families. Women, adolescents, and children from these groups tend to be among those we think of as hard to reach. And the question is that accountability in health systems, how can we improve it for them? That lack of accountability means that these people, particularly pregnant women, die, suffer abuse, are detained for user fees. Adolescents are denied information, turned away from services, especially services for sexuality, including sexuality education, contraception, safe abortion. Even when access improves sometimes and user fees are removed or subsidies may be provided, quality of services can often remain a problem. And these problems in the health system that beset poor people, poor women, adolescents, and children are often without recourse or redressal. And that, of course, is the huge challenge of accountability. Now, what's the effect of COVID-19 on these problems which have been with us and are in some senses endemic in some health systems for quite some time? The Independent Accountability Panel's report for this year, which will be released shortly at the high-level political forum, found in a survey of 30 countries that 70% or more of health workers said they had inadequate access to sanitary products. And health workers, women health workers who abound at the lower ends of the health system are more likely to be infected than their male counterparts. The New York Times had a report, sadly from my own country, a couple of weeks ago, which talked about a pregnant woman who was turned away from 8 hospitals in a period of 15 hours and then finally died. And those are the kind of dramatic results of the pandemic in terms of the way in which health systems are not functioning for the poorest people. And one of the worst things that's happened is the diversion of resources from where they are normally needed and used for women, children, and adolescents. Immunization programs have fallen. Health workers have been diverted to COVID duty. Children are without midday meals, which they typically get in schools. Violence against women and girls during lockdowns. Some people have called that a second pandemic, parallel to the pandemic of COVID-19. And we could end up seeing a big increase in deaths of pregnant women and children, as well as disruptions in contraceptive supplies and the push that we see in many places to keep safe abortion services, even when legal, out of essential pandemic packages. How can accountability be strengthened in the context of this sort of, we can only call it a crisis of health service access? How can it be democratized in this really grim context? And I'm going to give you 2 examples, one from the bottom and the other from the top. In 2017, Ethiopia started very seriously implementing community scorecards. And those community scorecards, each one of them had to be filled in by anyone who came in to primary health services, health center, lower level hospital. And what they had was simply 6 basic questions. Did you get caring, respectful, compassionate service? How long did you have to wait for the service? What's the availability of drugs, diagnostics, and supplies? How is the infrastructure in the facility? What's the availability and management of ambulances? And what about the cleanliness and safety of facilities? So not a whole lot of things, but a way in which patients could grade health centers on this basis. And a health worker from one of those health centers herself said anonymously, patients are benefiting from the improvements made due to community feedback, especially women and children under the age of 5. And we ourselves are benefiting because we know better our own strengths and weaknesses. And this motivates us in our work. The other quick and final example I want to give you is from the other side, from the top. Guess in which countries, or maybe you'll guess too easily, we've seen the best responses to the pandemic. The countries, I'll tell you, are Denmark, Finland, Germany, Taiwan, Iceland, and New Zealand. And what's common to all of them is that all of them have women leaders. Now, what is it about women leaders that makes them so much better at ensuring accountability in health systems? And what seems to be working in these countries is decisive action that's evidence-informed and the ability to engage with people. And I think in the plenary earlier today, you saw a great example of that from Shailaja Teacher, the health minister from the state of Kerala in India. And in Finland, quite at the other end of the economic and social spectrum from Kerala and Kerala, you have the youngest head of government in the world, Sanna Marin, who brought her youth to bear on insisting that her people respond through spread information through social media influencers. And that seems to have had an enormous effect in Finland in fighting the tide of misinformation that is swamping so many places during this pandemic.
Thank you.
Over to you now.
Walter.
Okay, thank you, Gita, for this nice introduction in a very relevant issues. I'm going to make emphasis on how rapidly is the context changing for our work on accountability. So first, I want to refer to the immediate and midterm effects of COVID-19 that are already occurring. First, we need to be aware that vulnerable populations are dramatically increasing. We have historically the left behind, the ones that Gita mentioned, which is people that historically have been discriminated by gender, race, ethnicity, sexual orientation, etc. But depending on countries, this left behind can be a rather large population or less so. But what is very important to recognize is that due to COVID-19, we have many families whose vulnerability has been exacerbated due to food insecurity, because they're unable to mobilize to receive public services such as health and education, or because they lost the breadwinner within the family due to the virus. So because of all of these situations, the number of families that are in situation of high vulnerability has just expanding greatly all around the world. The second issue that I want to comment is that in the majority of countries around the world, countries have failed in several fronts. The first one is that adequate information about the virus, the risk and ways of protecting has not been conveyed in an adequate manner to people. And by this, I'm not referring having your top scientists giving a press conferences in a very technical language. I am referring to an effort by authorities to explain in a simple and common language to the general public about what is happening, and also talk to them in a very honest manner instead of hiding information or misleading information. Secondly, we have that this failing of communication between the authorities or public servants is causing a breaking of trust between the people and authorities and elected officials. And very importantly, is that this breaking of trust is all over the world, in rich countries and in poor countries. So that means that regardless of whether you're a poor or rich country, you actually fail very badly in terms of informing your people about what's happening with the virus. And the main effect being the total breakdown of trust. The third main aspect is that public policies and initiatives that countries have implemented to reduce the negative impact of the lockdowns have not been consistent, and in many countries have been benefiting and reaching only some subpopulation groups. In most cases, those left behind or the poorest of the poor had actually not been reached by these public policies initiatives, which is causing serious inequities and unfair situation in many countries. For example, I'll give you an example of my own country. Because of the situation of the lockdown, the people not having food and so forth, the Guatemalan government just implemented a rapid response of transferring resources to people in situation of poverty. However, to identify the poor, they use the electricity bill as a way that whoever household they consume a small amount of electricity, that means that they are poor and they qualify for the transfer. As you can imagine, the poorest of the poor do not even have electricity in their homes. So they didn't qualify for this program. Because of the work of many organizations, including my organization, about making clear to government that they were excluding the poorest of the poor, they introduced a second program. And this second program was transferring resources to families through bank cards. They would send a bank card and people would have to go to a cash point to get the money out of that the government sent. Again, you can imagine that very rural and poor communities will not even have a cash station. So again, two policies that the government aimed to support, but because of the system had structural inequalities, they didn't have ways of reaching the poorest of the poor.
Thank you very much, Walter. Do you have one last comment before we move on?
Yes, the last comment that I wanted to say is that accountability in this context is be able to bring a trust, but only if we return to the basic accountability, which is building relationships and not concentrated too much on the tools such as the scorecards, but on the building of relationships. I'll stop here.
Thank you very much. So now we're going to be sending all the participants out into small groups. This is an opportunity for all of you to connect with other participants for 7 minutes before we bring you back for a 20-minute discussion with our presenters. And when you guys go out there, we have a question for you. First of all, we'd like you to introduce yourselves. There won't be a facilitator in the room with you. And discuss for you what was most thought-provoking about these two presentations you just heard. And again, we will be sending you out and we'll see you in approximately 7 minutes. Thank you. So Gita, why don't you go ahead and kick off this conversation? What were you not able to include into your presentation? What vital piece of information would you like to include and share with everyone?
I think, well, there's a lot of things that can't be said about accountability in 5 minutes. I think one of the biggest challenges that we have in advancing accountability, COVID or no COVID, is the relationship between accountability and power. Accountability is needed because our health system reflects the inequalities in power, whatever it may be based on. It may be based on income or wealth or your caste status or your racial or ethnic status, whatever the reasons why power is differentiated in society is the reason that we have people who are marginalized and who need accountability. If we were all equal in power, we wouldn't have an accountability problem, because then we would have complete solidarity. Everybody would see everyone else as being like themselves. And I think that's a very, very, for me, that's a very important element in accountability. And in moving accountability forward is to see what is it that needs to happen in order to shift that power balance, to shift it towards the those who have been on the weaker end of the power balance along so many dimensions.
Yes, yes. I would like to invite our audience to use the chat function in Zoom to go ahead and comment on what you discussed in your breakouts, and also to ask Gita and Walter any additional questions that you may have thought of during their initial presentations. And Walter, I'd like to ask you to start off, how can we start working on accountability if we have a breakdown in trust in our institutions, rules and regulations, and our government?
Yes, so my proposal is that we must return to the basic of social accountability. Social accountability started as a process of building relationship among different stakeholders. So the concentration was in a very unequal stakeholders. How can you bring a basic level of trust to start working about the goal use indicators? In the process, especially in the last 10 days, accountability became more an emphasis on tools, on the scorecards. And many organizations understood that accountability is about picking the scorecards and implementing it. The basic accountability is to facilitate process of empowerment, especially among the most disempowered actors, which is a user of healthcare service, so we can build the conditions for creating this trust. So to me, that's going to be crucial. Post-COVID-19, accountability must return to its basics, which is about building trust among different stakeholders. And for that, we have very clear frameworks and process already available from the legal empowerment field, but also we have organizations that have a long history of facilitating this process of trust building.
Thank you very much. Gita, we have a question from the audience. How can we use the current reactions to the pandemic, such as the protest, anti-racism, and anti-tokenism of young people, to advance accountability?
I think one of the things that's that is very striking, and it's very much connected to the trust issue that Walter raised, is when you have a situation where the powerful are actually creating divisions, exacerbating divisions within society, trust starts breaking down all over the place. And the first place it breaks down is, of course, for the marginalized, whose level of trust in institutions, in the way the system works, is already weak. The system doesn't work for them. And so why should they trust the system? So if we need to get beyond that, we really need to work towards healing those divisions, moving beyond those divisions. Now that may be easier said than done in many places, because sadly, in far too many contexts, leaders and others, political leaders and others, seem to be using the technique of divisions in order to stay in power. And so we need to be able to break through that, whether it is through elections, whether it is through mass mobilization, whether it is through understanding. I think it's really, really important that we do that. And in addition, I think misinformation in today's age, with the pandemic of misinformation, good, strong, clear information is critical. And I think in far too many places, unlike, we aren't yet following the example of Finland, where social media enhancers, or whatever they're called. I'm too old to remember to know what they're called. Whatever they're called.
Influencers, I believe.
Thank you. Thank you. Influencers, social media influencers are playing such a great role. And we're not using those techniques and methods for the right reasons or the right causes. And I think we could do that. We need to use that as well, just to add one other thing, to deal with stigma, because stigma is a huge problem in this pandemic. It's part and parcel of the creation of divisions. Such and so group is responsible for the pandemic. Such and so group is the reason why we have the spread of the disease and why people are dying. We need to be able to break through those kinds of complete misinformation in order to be able to build that trust and use the social movements in order to advance trust.
Wonderful. And how can we stop making people vulnerable, Gita? Or more
That's
vulnerable,
such
I
a
should
big,
say.
yeah, that is such a big question. Going beyond what I just said and what Walter said before that, people are vulnerable because people have been rendered more vulnerable um, for in 2 or 3 different ways. They've been made more vulnerable because of the creation of divisions and stigma. They've been made more vulnerable because of the diversion of resources away from essential needs. And they've been made more vulnerable by the fact that we have all too often macroeconomic and other policies that actually call for fiscal stringency and cuts in health budgets, reduction of payments for health workers, the conversion of health workers into piece rate paid informal sector workers. You're not going to build back an accountable health system with that, with those kinds of approaches. And I think for me, those are the 3 or 4 elements of building back accountability into the system. Making sure there's adequate resources in the health system, not turning health workers, especially those at the bottom who are largely women, into piece rate, part-time, poorly paid workers, ensuring that we fight stigma and division as strongly as possible, and using the data systems that are now available and that we can use, the information systems that can be used for good as much as they're being used for evil all too often.
Wonderful. Walter, can you expand on how to move away from the political point scoring achieved through plain speaking and trust building?
Yes, so the experience of many organizations, including mine, throughout over 15 years, 20 years that we have been doing social accountability, is that when you want to build trust among stakeholders, this is best done as an organic local process. Instead of a top-down policy, it is better to do as an organic process like that. So I think that we can move away from this political scoring point if there is a policy that is national, it should be that each district or local government should implement their own processes to rebuild that trust instead of trying to claim from the top that everybody should have trust now. So I think we should understand that. And even us as an NGOs, as a donor, funders implemented, should understand that instead of finding an easy solution that is implemented all over the country at scale, we need to go back to the basics again of facilitating conditions for each locality of each local government to create their own process, their own organic process to rebuild this trust among all stakeholders.
Wonderful. So are there any additional way that policies can enable us to reach the hard to reach? Building on an example that was given about if it not working. Walter.
Yes, I would say that we have a challenge, the challenge that I mentioned, which is the number of vulnerable population is just massively increased all around the world. But that also becomes an opportunity in which we can actually amplify the number of people, the constituency of people that want better services, better policies, so the number will be larger. So the force that they can have, the power that they can gain in terms of influence, government's influence, public policy is also larger. So we should see it as an opportunity that we have more people now that they can build alliances to have more influence in policy making and progressive policies, and also in bringing equity for everyone.
Great, thank you. Can you share where the future lies for the IAP? What's the latest thinking around that?
The IAP, like many other institutions, is, I suppose, running hard to keep up with the rapidity of change. And there's so much change happening. The Independent Accountability Panel thought that its primary the primary thing it needed to focus on was how to integrate its work with all of the focus on universal health coverage that we were all only 3 short months ago so focused on. I don't hear the word UHC mentioned in the discourse, not just of the IAP, anywhere at this point. I mean, it's just, it's sort of everyone's scrambling like the Red Queen in Adolescent through the looking glass just to stay at the same spot. The Independent Accountability Panel's 2020 report actually is one that I would strongly recommend. We've taken a new tack in it. It's a much more lively and interesting report. It's called Caught in the COVID-19 Storm: Women's, Children's, and Adolescents' Health in the Context of UHC and the SDGs. And despite that very long title, it actually has some really interesting things in it. I don't think I'm allowed for embargo reasons to say what's in it, but I do strongly recommend it. It's a really interesting report, and hopefully we'll be able to build on that towards our further work.
When is that report out for everyone? Is it mid-July?
Yes, it's going to be launched during the high-level political forum.
Okay, wonderful. All right, we have time for about one more question for Walter. Do you have examples of how reducing inequality has been an explicit target and incentivized in health plans? For example, reducing the difference between highest and lowest wealth quintiles. Otherwise, it seems we just track coverage without really striving to reduce gaps.
Let's see. Yeah, there are examples of different countries that have they have achieved the reduction in inequality, but there are usually two major caveats to that. The first one is that you can show the reduction in inequality at aggregated numbers, like in quintiles, but when we go within those quintiles, there is always some poorest of the poor that were left behind. When they were added to the quintile, of course, the gap was reduced, but still within that quintile, there is the poorest of the poor, the marginal, that still did not benefit. So I think that the importance of the social accountability work is not only to look at the reduction of gap between quintiles, which is important, but also who within those quintiles are actually benefiting, and to make sure that we are reaching the poorest of the poor or the most marginalized in this effort.
Great, thank you both so much. And we're going to transition now, and everybody, if you could return to the main plenary. Caroline, do you mind putting the, up? There it is. In the chat room, that is the link to the website, or you can just go back to your website and we will be closing this room. Again, thank you so much, Gita and Walter, for sharing what you've shared with us today. And everybody, thank you very much for joining us. Bye-bye.
Bye.
Thanks, Barbara.
Thank
Thanks,
you.
Walter.
Bye.
Bye-bye.